Jeff Bezos isn't the only billionaire breaking into the pharmacy business. Mark Cuban is challenging pharmacy benefits managers with his Dallas-based company, Cost Plus Drugs. His company is now looking to increase access by partnering with independent pharmacies to expand its membership offerings and compete with the big pharmacy chains as they shut down in rural and low-volume areas. Here to discuss is Cost Plus Drugs CEO Alex Oshmiansky, joined by Yahoo Finance's Anjali Kemlani. A big thank you to you both. So obviously you're not new to this. The company is not new to this, but is continuing to expand here. So how do you plan on differentiating yourself, especially as you get some of these other tech companies now also coming into the health space?
Yeah, Mark is very fond of saying our product isn't pharmaceuticals, our product is trust. I think we differentiate ourselves by taking transparency to its logical end, trying to build that foundation of trust with our patients and the providers that partner with us as well, that we're trying to do the right thing. We're trying to cut out the bad acting middlemen in the supply chain and get patients access to their medication and make business more sustainable for the pharmacists and other clinicians that partner in our ecosystem.
Alex, great to see you, Anjali, here. Talk to me about this push into the rural areas and independent pharmacies in particular, because they have been struggling for some time and often get ignored, compared to those retail chains we saw that, especially during the pandemic with vaccine distribution. So how does this help and what is the goal here?
Yeah, so my background, I'm a clinician myself. I'm a physician, diagnostic radiologist. I know on a very personal level how important it is to have a clinician in your area that knows you and can provide the care you need. And it's always been in our plan to try to support the local pharmacists who are really in their community, who know their patients, who are really doing the good work there, but are being taken advantage of by bad actors that control the payments. I think it's somewhat crazy just from an anti-competitive perspective that CVS Caremark oftentimes gets to set the rates that independent pharmacists are paid. Like, that's kind of crazy if you think about it. And it's in their interest to try to drive these small pharmacies completely out of business. So our perspective is by cutting out the bad acting middlemen, we can decrease the price to patients while making independent pharmacy, which is so important in these small communities, more sustainable as a business in the long term.
Absolutely, because you help with the volume there. Talk to me about the competition, though, with other PBMs, because just today, Cigna announced through Express Scripts that they, too, are focusing on independent pharmacies and are looking to increase the reimbursement to these pharmacies. How does that compare, or does it compete in any way with what you're doing?
Yeah, funny timing there. No, I think that these companies have, taken advantage of small independent pharmacies for so long. It's hard to envision anything transformative in that regard where they will actually start supporting these communities. I think just look at the history. Has it gone well in the past? It's hard to envision it turning around at this point. From our perspective, our goal is to try to improve patient access, patient healthcare, the ability of clinicians to do their work. So if part of what we're doing is just to, drive change in the industry as a whole, that's a win. If it incentivizes others to act in positive ways, we've done our job.
And we know that the Biden administration has been looking at the cost of prescription drugs and really trying to crack down on some of these excess costs, and that you recently launched the Team Cuban card in Austin. Talk about the competitive edge that really gets passed on to customers versus some of the existing big players in this space.
Yeah, absolutely. And it's all about transparency. I see on the screen here imatinib. That's sort of our extreme edge case example of sort of bad price dynamics in the marketplace. So you see the retail price there is $2,500 for that dose of imatinib. What we see is the actual adjudicated price. So the price, if you have a high deductible plan, that you'll be asked to pay at the counter before you can get that medication is $800. In the meanwhile, our price is $12. And we are, if anything, paying more for that drug from the manufacturer than large chains that are able to negotiate prices with volume as compared to us. So where is that delta of essentially $800 going? It's not going to the pharmacy. It's not going to the manufacturer. So it's just going to all these intermediaries in the supply chain. And sort of the startling thing is, we launched imatinib at this price over a year ago, and the adjudicated price at the counter hasn't changed. I think these big entities are just addicted to these absurd profit margins from these ultra high cost generic products and are unwilling to bring them down. I think our competitive edge is we're small, we're nimble, we're able to, to move forward with these products at the price that they should cost. And we're not addicted to those margins that have been there for, sometimes decades.
Does that play a role, Alex, in what Mark Cuban tweeted about when he announced this, that the big pharmacy chains don't like you? So is that part of it where they are also taking a part of this, especially as we know many of them belong to larger entities now, or are very diversified in what their business lines are? Does that play a role in all this and sort of where the money is going? And how do you differentiate that way?
Yeah, absolutely. All of these entities, the big pharmacy chains are vertically integrated up and down the supply chain. CVS Caremark is in its name. It's vertically integrated as, a whole, as a pharmacy chain, as a PBM. It has its relationship with through Red Oak, its sourcing program with Cardinal, and it has underneath. I hope I don't get the name of this right, Zinc, its rebate aggregator, which is a subsidiary corporation based in Switzerland that takes a cut of pharmaceutical price dollars, so-called rebate dollars, where it can never be audited before those dollars are sent back to the parent corporation in the U.S. It's just this mess of entities and subsidiaries, like, who knows how many. We heard of one starting in the Caribbean recently, specifically around generic drugs. I'm not sure if that moved forward, but there are all these complicated price dynamics manipulations that, the big actors in this space go through to get additional margin on pharmaceutical products at the cost of largely two groups, individual patients, so the most vulnerable and indigent patients or indigent people in society are being taken advantage of by these sophisticated price manipulations, as well as large employers. Going back to that imatinib example, for the most part, that $800 is being billed back to employers as basically hidden tax on our entire economy. It's basically rent-seeking behavior, and that those resources could be better used elsewhere. So our Team Cuban card, it's a benefits card, not just a discount card. So by default, patients get our transparent cash price, the same one that they would get through our website at their local pharmacy. But we can also bill that back to their employer as well, which multiple independent studies at this point, academic groups from Harvard, Vanderbilt, multiple independent consultancies have all sort of found the same numbers, that our pricing model saves 50 to 60% on drug spend as compared to traditional PBM pricing models. So we're hopeful that we'll not just improve the lives of individual patients, but save the economy significant amounts of money as a whole.
I mean, that transparency is key, especially when you think of how much medical debt people end up getting into just trying to get some of the basic care that they need. We do appreciate you joining us this morning. Alex Oshmiansky, Cost Plus Drugs CEO, and Yahoo Finance's own Angelique Kamlani. A big thank you to you both.